Well, and it's important for the seniors, but it's also important for people who are disabled,
Right,
who go
right.
on Medicare at younger ages. And suppose that you hurt your back in you work in the Ford plan and you hurt your back, and you end up on, you have to retire early.
Yeah.
And some of those people get into trouble with their pain medication, or they have depression issues. Uh, so some of that younger Medicare population is actually quite important.
Yeah.
And by the way, one of the things that I found very concerning about some of these policies, I actually looked at a private insurance policy that had some of the qualities of Medicare, uh, with that 50% copay. They actually imposed that 50% copay on visits to the psychiatric emergency room. And if
Mm.
you think about the public safety uh, dimension to mental health issues, if somebody feels they need to go to the psychiatric emergency room, imposing a 50% copay on that is
Yeah.
really discouraging someone from seeking help in a crisis that
Right.
that could be that could lead to violence or suicide, and
Well,
that's
let,
just terrible policy.
let me ask you more about that, Harold, because I know you've spent a lot of time thinking about violence in the seriously mentally ill. Do you anticipate, with the expansion of mental health services, that will in any way affect the likelihoods of horrible things like the Newtown massacre?
That's a really tough question. I mean, I think in some ways yes, and in some ways no. I think uh, a very smart psychiatrist said that incidents like the Newtown incident are not predictable, but they may be preventable. And I think that, will we be able to specifically intervene before someone commits an atrocity? Often that we will not. However, we can engage people in care who we know are at high risk for violence in a way that may reduce that threat in a couple of ways. So one thing that we can do is we can deal with the dual diagnosis population. The people that are the biggest public safety threat who have mental illnesses are people with co-occurring substance use. About 2/3 of the incarcerated population that has a serious mental illness has a co-occurring substance use issue. And so
Mm-hmm.
young men with these dual diagnoses, that's basically the ball game, with a lot of violence that involves the mentally ill. And right now, that's also the group of people that's exactly the uninsured population that we were talking about 5 minutes ago. So I talked to the sheriff of Cook County, who runs arguably the biggest mental health institution, certainly in the Midwest, maybe in the United States. I guess the LA County Jail might compete with it, as we've talked about before. So on any given night in the Cook County Jail, about 2,000 people there have significant psychiatric disorders. There are 10,000 people incarcerated, 2,000 with psychiatric disorders. About 90% of the people there are uninsured.
Mm-hmm.
And so these young guys who just don't have insurance. And once health reform is passed, and once Illinois does some complementary things, about 90% of these guys will be insured. And the sheriff has said that right now, tonight, there are people in that county jail, that enormous facility at 26th in California, who, if he had Medicaid coverage for them, they would not be there. They would be in a different kind of a facility where they could do a better job dealing with their mental health and substance use issues. And
Mm-hmm.
I also think in the area of prevention, when people have Medicaid coverage, you can deal with their substance abuse or mental health problem at earlier stages, where you at least have a shot at arresting something that might lead to a problem. Now, most of the criminal justice issues involving the mentally ill are sort of not the Newtown type variety of things. They're people shoplifting, people fighting, people being a public nuisance, things like that. But I think that health reform will definitely help if we do a good job implementing it. We
Mm-hmm.
can talk about what the issues are, but there's no question that the Medicaid expansion in the Affordable Care Act is the single most important thing that we're doing right now in public policy to deal with the public safety issues involving mental health and substance use. There's just nothing that comes close to that in the scope of it, and the key is to make sure that we do a good job with it.